Hello, my name is Joel Strauss, Health Officer with the Bay County Health Department, and today's Thursday, August 19th, and here's the update for COVID-19 and the status of the COVID vaccine here in Bay County, Michigan. Today, our test positivity rate in the county is 9.2%, and the 7-day average of confirmed cases has risen to 121 per 100,000 people, putting Bay County into high transmission category by the Centers for Disease Control. Yesterday, the Health Department put out guidance that highly recommends, when the community is experiencing high transmission levels, everyone, including fully vaccinated individuals, wear a face mask in public indoor settings to help prevent the spread of the Delta variant and protect others. Wearing a face mask is particularly important when attending indoor public gatherings and where social distancing is not able to be maintained. Given the community transmission status change, the Health Department also encourages businesses, community, and faith-based organizations and event organizers to consider the latest public health recommendations when determining risk mitigation strategies for employees, customers, community members, and events. These recommendations are based on emerging science showing that the Delta variant to be highly infectious and able to spread at greater rates than any other strain of COVID-19. But face masks alone aren't the only strategy to keep ourselves safe and to stop this current wave. A layered protection strategy should be followed to ensure a healthy environment, allowing all Bay County residents the best chance to remain healthy and physically present at work and in the classroom setting. As a community, we should appropriate the following risk mitigation measures. They include getting fully vaccinated if eligible. Research shows that the COVID-19 vaccines provide protection against the Delta variant, and most people who experience a breakthrough infection after fully being vaccinated report mild or no symptoms, with an extremely low risk of hospitalization and death. Past infection with COVID-19 does not assure protection, so people who have had past COVID-19 infection are still strongly encouraged to get vaccinated. High vaccination coverage will not only reduce the spread of the virus, but will also help prevent new and possibly more concerning variants from emerging. The second thing is to avoid crowded and unventilated spaces and make sure that you maintain distance. You should also maintain good hygienic practices, and you should stay home when you are sick and get tested for COVID-19. And if you do test positive for COVID-19, isolate yourself or quarantine if you're considered a close contact so that there is no further spread. This week, the CDC has authorized third doses of mRNA vaccines for persons with moderate to severely compromised immune systems to fight waning immunity. Recent studies from Israel and the United States indicate that while overall protection from the vaccine remains high, especially to prevent severe disease, hospitalization, and death, the overall protection from symptomatic disease can dissipate past 8 months. And just yesterday, the Biden administration has announced the authorization of the third doses to be scheduled for everyone in mid-September. The Health Department will provide third doses to the immunocompromised individuals immediately. We ask that you consult with your medical provider to determine if you meet the qualifying categories. You can receive the third dose at any of our regularly scheduled clinics or at any of our partner provider sites in Bay County. Some residents have expressed concerns about getting a third dose of the vaccine and wonder why it is necessary. As I mentioned before, recent studies indicate that full protection from symptoms of the virus begins to decline after 8 months. Overall, however, the vaccines are very effective at stopping severe illness, hospitalization, and death. But there are breakthrough cases, and the vaccinated can be infected and pass the virus on to others. There is still much more data coming out about the virus and the effectiveness of vaccines, but the bottom line is that the vaccines work. The alternative approach, or doing nothing, would be catastrophic. So if you want to avoid the unnecessary cost and suffering due to the virus, I ask you to get vaccinated as soon as you can if you are not already so. If you want your children to attend school without the interruption of illness or quarantines, please get yourself and your children, if they're eligible, vaccinated if you haven't done so already. Communities with lower vaccination rates have seen a greater proportion of children and adolescents with more severe illness from the virus. So please take that into consideration. Before we leave, we ask you to keep an eye on our Facebook page and website for the latest updates and potential changes to our clinic hours here at the Health Department and throughout the community. That's it for today. Please stay safe and be healthy.